Mr. Speaker, I have a quick comment on this issue of SHA, and I don't know why people get offended or worked up when we say SHA is working. What else are we supposed to say, Mr. Speaker? You know, Mr. Speaker, this addiction to bad news in this country, leaders must begin to live also and know that leaders are dealers in hope. I want to celebrate because I have visited 4 out of 6 of my sub-county hospitals in my county. And for each of those hospitals that I have visited, the one thing that I ask all the patients is, were you registered with SHA before being admitted? And for all of them, 100% that told me they had registered before, Mr. Speaker, SHA met part of their bill as any other insurance will be. So, Mr. Speaker, if we report back, we're only doing our duty because that is a work of a representative of the people. On this issue that has been brought by Senator Boni Khalwale, it's an issue that is very serious and requires the keen attention of those that are addressing this matter. I voted, Mr. Speaker, against the amendment that had seen transitioning of all NHIF staff into SHA, Mr. Speaker. Fully aware why I did that, Mr. Speaker. Because I know for a fact, Mr. Speaker, that 95 or even 99% of former NHIF staff are diligent Kenyans, Mr. Speaker, who went about their duties very well. They worked and served this country well. Those needs to be considered. But I am fully aware, Mr. Speaker, that in NHIF we had staff, Mr. Speaker, that were approving the amputation of a human being 4 to 6 times, yet we know a human being has only 2 legs, Mr. Speaker. You want us to take those ones to SHA as well? There must be a vetting process. And I want to believe, Mr. Speaker, that that process needs to be done in a way that no Kenyan ends up suffering unfairly, Mr. Speaker. And for that reason, Mr. Speaker, I hope that our health committee, Mr. Speaker, when they consider this particular matter, Mr. Speaker, will guide.
What is your point of order, Senator Boni?
Mr. Speaker, 105, you heard the Senator of Kericho accuse employees of NHIF for approving claims for people who have been amputated 5 times. Is it in order to mislead the country when it is a fact that even one limb you can amputate it, Mr. Speaker, 10 times? Yes, because, for example, Mr. Speaker, this is important. People should not call Kenyans thieves when they don't have facts. A doctor who is treating a patient with diabetes, the limb starts rotting. When the toes are rotten, you cut. When the hand goes, you cut. When the arm goes, you cut. When the limb goes, you cut. So why are we teaching people to think that there is no person who is clean? These clerks of NHIF who are now want to be punished, I'm afraid some powerful people in government want to employ their relatives,
Senator Boni,
people from their communities.
Senator Boni, your point of order is not sustained. Majority Leader, proceed.
The problem, Senator Khalwale, was on his phone when I was making my point. That's why he completely misunderstood what I mentioned, Mr. Speaker. The point that I was pursuing is a point of fictitious claims. Unless you want to mislead this House, Senator Boni, that NHIF did not have challenges of fictitious claims. That is in the open. Read, Mr. Speaker, from the reports of the Auditor General on operations in that institution. And we have said, for your benefit, Senator Boni Khalwale, that I am completely clear in my mind that 95 to even 99% of the employees that work in that institution are diligent Kenyans. I have said there must be a vetting process to establish that if there is an employee who was found, Mr. Speaker, to be involved in the business of handling fictitious claim and brought down NHIF, then we need not transition such employees into SHA. That was a simple point, Boni. I don't know why you would want to take issue with such proposition. Unless, Mr. Speaker, Senator Boni has joined Sifuna's band, whose duty, Mr. Speaker, is to get excited and say there is absolutely nothing right in anything that I say.
Senator Majority Leader. Senator Majority Leader, that is uncalled for. That is uncalled for, and I'll ask you to withdraw it. It's uncalled for.
I said Senator Sifuna's band, which never agrees with anything that I say. Surely, Mr. Speaker, unless Senator Sifuna wants to rise and say he agrees with the things I say.
Senator Majority Leader, just withdraw that.
Okay, Mr. Speaker, for the record of the House, I withdraw that comment, Mr. Speaker.
Senator,
no, offended by what?
Senator Mungatana.
Thank you very much, Mr. Speaker.